So this is in-home care agency services with the Oregon Health Plan, and we're going to talk about the provider web portal and plan of care and claim submission on the provider web portal. Okay, so our topics for today, we're going to talk about why we're moving to MMIS. MMIS is the Medicaid Management Information System. The provider web portal that I just mentioned is the provider access into that system for information that you need to submit claims or to check eligibility for a client, those types of things. So those two are kind of interconnected. The system, the main system is MMIS, and the provider web portal is your portal. So we'll have an overview of the in-home care agency's current payment process, and then we'll talk about the new MMIS process. We'll explain plan of care, which is new to you, but it's not that complicated, don't worry. And then we'll talk about provider claims. So just a little bit about the agency before we move forward. You'll notice that there are two different logos on the slideshow. So on the left, you'll see DHS, the Department of Human Services, and then on the right, you'll see the Oregon Health Authority. So this slide kind of explains to you why we're both involved in this training and why we're both involved with you as providers for the Oregon Health Plan. So on the left side, we have the Department of Human Services. A division of DHS is Aging and People with Disabilities, and that is where your in-home care agency program and policy information falls. So they maintain policies for Oregon Medicaid in-home care services. On the right side of the screen, that's Oregon Health Authority. One of our divisions is the Division of Medical Assistance Programs. Lots of folks call us DMAP. Some people call us MAP. Some people even call us OMAP because we used to be the Office of Medical Assistance Programs. So if you ever hear OMAP, that's us too. And what we do is we oversee provider enrollment and payment for Oregon Medicaid programs. So we maintain MMIS, and that's kind of why both agencies are in collaboration working on this program. Okay, so why MMIS? Here are some benefits of using MMIS. The agency can verify services before scheduling to make sure that those services are going to continue. You're also going to have online access to view authorizations and plan of care. Again, I'll explain what plan of care is. You can verify client eligibility before you provide services. And you can control your own billing. So this is a big deal here. You can bill as often as your business process allows. So if you wanted to go in and bill daily, you could do that. If you wanted to go in and bill every Friday for the week, you could do that. It's just as often as your business process will allow. When you submit a claim, you'll receive immediate claim status and messages that tell you about the outcome of the claim. So if your claim denied, it's going to give you some messages, and hopefully you can figure out why it denied. If it paid at a different amount than you were expecting, it'll tell you the reason for it. Also, you can submit your own adjustments. So if you have a paid claim and it didn't pay appropriately or you needed to make a change, you could change that right on the web portal and adjust it yourself. And you would get a new claim number and a new adjudication for that claim. You can also resubmit denied claims. Now that last thing there, you can copy paid claims to submit a new claim as well. And we'll go over that through the presentation. But basically what that means is if you use the professional claim format, when you get a claim to pay, you could come in the following week, the following month, depending on how often you're billing, and you could pull up that paid claim and click on copy claim, and it makes a duplicate, and you can change whatever information you need to bill the new date. So those are benefits. And then let's talk a little bit about your services. So in-home care agency services. Here's the current process. This is how everything is working as far as from the case manager forward. And some of this will still be in place, but as we move to MMIS, there's a couple of minor changes. So right now, the case manager completes a client assessment. They're supposed to do that annually or anytime it's needed throughout the year. So it's possible that even though it's supposed to be done annually, that things could change intermittently as well. The case manager determines eligibility. They figure out whether or not this client is eligible for these services. And then if the client is eligible, they create a service plan. You may have heard of the 546. That's maybe what you call the service plan. That 546 is for up to 12 months of services. And again, it's for 12 months, but sometimes the assessment is happening continuously and there may be changes as needed within that 12 months. And then they refer the client to an in-home care agency. So then the agency receives that referral and they meet with the client to determine the case. If they accept the case, then they serve the client. Currently, the agency is paid through the voucher payment system. That's the current process. The voucher payment system, this is what you're currently paid through. Each agency has a 6-digit provider ID in the voucher payment system, and it's this ID that they write the 546 under, the service plan. They issue payment, and your 1099 tax statement is issued. So this is the 6-digit ID that you will use for all services that are not paid through MMIS. So this is your current 6-digit provider ID within the voucher payment system. Okay, so let's talk a little bit about the MMIS process. So of course there are things that are not going to change. The case manager is still going to assess the client, determine eligibility, authorize the services, send the referral to the agency. The agency will have the opportunity to either accept that client or accept the case or not accept the case. So those things are not going to change. It's the payment process that's changing. So MMIS, for dates of service on or after March 1st, in-home care agencies will be paid through this system. So there are some agencies that have already started billing in MMIS. Many agencies will begin billing in June for May 1st dates of service forward. And then there are others who will begin billing in July for dates of service June 1st and forward. So you'll be billing the previous month. And an example of that, the metro area, the Tri-County area, they'll begin billing in July for dates of service June 1st forward. So each agency will be issued a new 9-digit MMIS provider ID. And it's under this ID that the MMIS plan of care will be written. So the plan of care is basically a payment authorization in the MMIS. So something has to be set up in the system that allows your agency to be paid for the codes that you're going to bill. And that's what MMIS refers to as a plan of care. So it's just like your authorization. It allows you to be paid within the system. Also under that 9-digit MMIS provider ID, your payments will be issued directly through the system, and you'll receive a 1099 tax statement. So keep in mind that for 2013, you're going to receive 2 1099 tax statements. One will be from the voucher system under that 6-digit ID, and one will be from MMIS with that new 9-digit MMIS provider ID. Okay, so and if that was not enough provider IDs, just a little bit more for you. So right now, you have a 6-digit voucher payment system ID. It's used for the service plan, the 546. You're going to get that new 9-digit MMIS provider ID. That's used for the plan of care and the provider web portal. So that 9-digit ID is the ID on the provider web portal that you would be billing under and verifying client eligibility under and looking at the plan of care. All of that is going to be that new 9-digit number. Now, in addition to that new 9-digit number, what we have to do is we also have to issue a new 6-digit voucher payment system ID, because the current 6-digit ID that you have that you've been paid under the voucher payment system with, that one is not tied to the MMIS ID. So we have to tie or link the new 6-digit voucher payment system ID to the 9-digit MMIS ID. So if you're more of a visual person, I've included that table at the bottom there. So you'll see the first column there, the current process, is grayed out because that 6-digit ID that you currently have in the voucher payment system that your 546 is written under, that's going to go away because you're going to have a new 6-digit ID in the voucher payment system and your new 9-digit ID for MMIS. So that new 6-digit ID that you get from the voucher payment system will still be the number that the 546 or the service plan is written under. And then your MMIS 9-digit ID will be the one that you bill under, that you verify client eligibility, and you look at the plan of care within the system. All right, so let's go ahead and move on from there. I hope that wasn't too many IDs for you. Don't want to confuse anyone. All right, MMIS payment system. All benefit plan and plan of care information is in the MMIS. So what that means to you is there's a specific benefit plan that each client has that covers your services. We're going to talk about those specific benefit plans in just a few minutes here. But when you verify client eligibility, you're going to see that benefit plan. Plan of care, again, that is POC written here in this top bullet. That's your authorization within MMIS to be paid for the services that are authorized. So what you'll see on that plan of care, and we'll show you one, is the client ID, the dates that you're authorized, how many units you're authorized for. So it's pretty much a plan of exactly what you're going to bill within a certain time frame. And then providers use the provider web portal, and I've put the link at the bottom of the page there, into the MMIS to verify information. So you're looking at client eligibility, their benefit plan, to make sure they have one of the benefit plans that covers your services, the plan of care, and then you're also billing provider claims on the web portal. So again, kind of just a little bit more detail on what I just said. So provider web portal uses the eligibility, verifying the benefit plan and the dates. Plan of care, verifying service date, procedure, and allowed amount. And then billing for services. So there's two different ways that you can bill on the provider web portal, and we will talk about both. One of them is the professional claim form, and the other one is what we refer to as roster billing. Again, I will show you both. And then accessing the provider web portal. So we're talking about all this new stuff that's coming up. Well, how do you do it, right? So for accessing the provider web portal for the first time, you do need your new MMIS provider number. So you will receive your new provider number in the mail. You should receive it about a week or so prior to the first of the month that you're going to begin billing. So again, if you're going to start billing in July for dates of service in June, then you should receive your MMIS provider ID and your PIN within about a week before July 1st. So I think the date that we said was June 24th. Was that correct? Okay. So you'll get a letter in the mail that welcomes you as an Oregon Health Plan provider with a new MMIS provider number. So that 9-digit number will be in that letter. And then you'll get a separate letter with a personal identification number to allow you access into the provider web portal. Now the reason it's two separate letters in two separate envelopes is just for security purposes. We don't want to send you one envelope that has both your MMIS provider ID and your PIN into the system, because then anyone that gets their hands on that letter could get into the system, and lots of private health information is in that system. So initial access, MMIS ID and your PIN. The PIN is issued by DMAP. Again, we do all the MMIS processing. And then once your account is set up, you can discard the PIN. You won't need that again. It's only used for that initial access. If you have any trouble with this process, if it comes to, let's say it's June 25th and you still don't have a provider number, maybe it's getting closer to July 1st and you don't have a PIN yet, we do have a DMAP Provider Services unit that you can call and talk to about that, and they can see where we are in that processing. So I do have that number at the end of the slideshow, so stay tuned. Okay, so Provider Web Portal account setup and maintenance. It's really quite simple. Once you have your ID and your PIN, what you'll do, this is what the PIN letter looks like. Just an example there. And I've circled the 2 items that you'll need. And you can see that first circle there at the top, the provider number. This is why you'll need your other letter as well, because this only gives you the first digit and the last digit and then a bunch of empty space in the middle. Again, that's for security purposes. We don't want to include the entire number because then anyone could get in. So here's your provider ID. And then that second thing that I've circled down there, that's your PIN. It's usually alphanumeric, and it is case sensitive. So those are the 2 important items on that letter. And then you'll start at the Provider Web Portal. So this is the link, again, to the Provider Web Portal. And then that'll take you to a page that looks like this picture here. And from there, what you'll do is on your account menu, you'll click Account Setup. That'll take you to this page. So to set up your account, in the Login ID field, you'll put in that 9-digit MMIS provider ID. And then you'll put the PIN in the second field. And then you'll click Set Up Account. So if you have this slideshow handy when you're setting up your account, that'll be step-by-step exactly what you need to do. So that takes you to this screen. You can discard your PIN. You should not need it again. You'll notice it's grayed out at the top of the screen there. So in this section, you're going to fill out every field. All the fields are required. Keep in mind that your username cannot be your last name or your first name. It really should be something that has to do with the agency and not the person that's setting up the account, because this is going to be the administrative account for the in-home care agency forever. You can set up individual accounts for people within the office that can be their own usernames and all that good stuff, and it can be more personal, but this one is for the agency. So there's the username, and then the contact name and phone number. The secret question, it actually doesn't accept a question mark, so just put in alphanumeric stuff there. And then the answers are case sensitive, so keep that in mind. These questions and answers will be used if ever you need to reset your password. It's going to ask you these questions. And then on the right side, you're going to enter a password and confirm the password, and then the same thing with the email. Now you'll see the little green box on the right side there, your password requirements. As you're setting up the password, keep this in mind. At least 8 characters, 1 uppercase, 1 lowercase, and 1 number. And then don't forget to check the I agree box all the way back over on the left, and then you'll click on Submit. If you get to this page, this means you're in. What you'll see is over on the left side under What's New, you'll see your 9-digit MMIS provider ID. And then on the top there, you'll see a menu. You'll see lots of items available at the top. So this is your front page. Every time you log in successfully, you'll get to this page here, and all your menu items will be available for you. And you'll notice on this page I have captured the account menu, because we're going to work off of that account menu for a few minutes here. So lots of things that you can do under the account menu. Okay, so clerk setup. As I said, you can set up other folks in your office on the provider web portal to have access to whatever they need. So on your account menu, you'll click Clerk Maintenance. On that screen, you'll click Add Clerk. That's right over here on the right. You'll enter the clerk information here. Very similar to what we entered on the other page, but not quite as specific. They'll enter their own secret questions. And then this password is really important to remember that the password requirements are the same, but this is a temporary password. So you just assign a password to people as you set them up in the system. And then when they go in for the very first time, they're going to be prompted to change that password. Okay, step 4, right here, what you'll see in these sections, this right here is available roles. So when you first come into this page, all of these roles that I have over here on the assigned roles, they're actually over here in the available roles, and you have to assign them to this person. You can assign them individually by clicking on them and using the single arrow. If you have someone in your office that you would like to be the backup administrator, you want to give them all roles, all of the roles will move if you use the double arrow. And that's just either way. Those arrows work the same way. And then you would click Submit to save that clerk. And then that clerk would go in with the username and the temporary password that you gave them. And they would be able to access any of these assignments that you've given them as long as they change their password as soon as they get into the system. This is also where you would remove clerks if ever you had someone leave the company. You could come into this same screen. You would have a list of clerks right here where you see this blue row. And you would be able to click on a clerk. You could either change roles at that point. You could take away assigned roles, or you could add roles. Or you could use this button here to remove the clerk, where they would no longer have access to your information in the provider web portal. So that's clerks. That's other folks in your office that need access. Next is account maintenance. So this is on your own account, or your clerk can do this with their account. Under the account menu, you would click Account Maintenance. This allows you to change phone numbers, emails, secret questions, anything you need to change here. So you would change that information and then click Save. You can always click Cancel if you had entered some stuff in here and you changed your mind. You could click the Cancel button, and then your changes would not be saved. All right, one other thing under the account menu here, if you click on Change Password, first of all, we do recommend that if you get your password wrong twice, because if you enter the wrong password 3 times, you get locked out. If you're locked out of the provider web portal, that's a phone call or an email to the provider services unit and possibly a wait time to get back in. So if you enter the wrong password twice, go ahead and click on Change Password under the account menu. All right, so then you would enter your current password, enter a new password, and confirm the new password. Okay, so that's it for the account menu. That's just the basics about getting the account set up, getting everyone in your office set up, changing your password if you need to. Now let's talk a little bit about what you're actually going to use the provider web portal for. So first of all, you're going to be able to verify eligibility. So here's our menu again. So on that front page, you're going to click on eligibility. You'll get to this screen here. You'll notice on this page here that I have the green box that tells you exactly what you would need to enter in order to look at eligibility for a specific client. If ever you're in the system and you don't have my pretty green box there to tell you what to enter, if you leave everything blank and you just click on this search button over here, you'll get a similar box that'll say pretty much the same thing. It tells you exactly what you need to enter in order to verify eligibility for a client. So my steps are to enter the client information right over here. Enter your dates of service. This is the from date of service and the to date of service. Remember, your to date can never be after today. You can only search through today. You can search for one day, so your from date of service and your to date of service could be the same day. Or you can search for a range of up to 13 months. Keep in mind that your results that you get, your eligibility file that you're going to look at, is only going to give you information within the dates that you requested here. Okay, so once you have everything in, click search, and the system will return an eligibility file. And that's what this looks like here. So you'll see here's my client under the client information up here. I'll see the client ID, the birth date. If the client has Medicare, I will see Medicare dates here within the range that I searched for. I'll see the client's name here. I'll see the branch ID and phone number for that client listed right here. And then the benefit plan. Remember I said the benefit plan is what covers your services. So these over here, you'll see the little yellow box that I've put here. These are the benefit plans that cover in-home care services. And you'll see this person here has the BPA benefit plan. So they would be covered. Other things on this page, and I think I have these outlined individually. Maybe I don't. Okay, so other things on this page, not so important to you, but just in case you're one of those people that looks at the page and says, but there's more stuff and I want to know. I'm one of those people, so I like to explain. All right, so service type coverage and copay, this is for medical providers that are in here looking at basic benefit plans, and they can populate this area by clicking on one of the benefit plans, and it tells them what types of services are covered and whether or not there are copays. TPL, that's third-party liability, that's private insurance. So if this client has private insurance, you'll see it listed there. Managed care, this is if the client is enrolled in any of our managed care organizations or coordinated care organizations, and you'll see those listed there. Lock-in is if a client is locked into using a specific pharmacy, so the pharmacy information would appear there. And then right down here, the very last one is service limitations, and that is specifically for procedure codes that have any limitations on them. So providers come in here and they put a specific procedure code, for example, a dental cleaning or an eye exam. And they get a message under service limitations about whether or not that person is eligible to receive that service today. So that's what service limitations is. Again, you as an in-home care agency, if you're coming in here to verify the benefit plan, so make sure that that client has one of these benefit plans that covers in-home care. And to verify that this is your client, those types of things. Okay, so that's the eligibility. Next is plan of care. Again, plan of care is just your payment authorization within MMIS. You'll find plan of care under POC. So you'll click on search under the POC menu. And what you'll get to is actually a shorter version of this page. See the white line I'm pointing to right now? You will only see the box above this white line when you first come into this page. And then what you have to do is enter search criteria and then click search. And then that's when this appears down here, the search results. Now, if you leave this blank and you don't enter anything at all, and you just click on search, what will happen is your search results will show a list of all the plans of care that you currently have under your agency. So all the plans will be listed. Now in your search results, If you have more than one line item listed, you'll click on the line to view the actual plan of care, and that's this detail section right under here. So I clicked on this line here, and then the detail populated right underneath here. So the next page breaks down that detail. So box 1 up here, that's the agency information. That's your information about your agency. Box 2 is client information. Box 3 is the service code and the modifier, if applicable. So you'll notice I included modifier there, but you're not necessarily going to be using a modifier. If you are supposed to use a modifier on the claim, it'll be listed under modifier right here. It'll be 2 digits. But this is the procedure code that you would use, specifically on this plan of care. And then it tells you what that procedure code means. And then box 4, these are the dates that this plan of care is in place. So this one was July 1st of 2012 through June 30th of 2013. And then box 5, over on the right, this is billing and financial information. So you can see units. Those are the units that are allowed. And this is how often they're allowed, monthly. The unit qualifier, this just means that this procedure code, 1 unit of this procedure code is a 15-minute unit. The dollars here don't necessarily reflect exactly what you should have. They should be the amount of the procedure code, shouldn't they, on the regular? They won't? Okay. And then you can see it's going to pay the system price, which is why the dollar amount is not there. Usually the dollar amount is if the system is paying something different than what's already set up in the system. Status is active, and then you can see down at the bottom, it'll tell you your balance and the amount used. So you can see on this specific plan of care for these dates of service, I've already used 20 units. So I've already billed and been paid for those 20 units, and I still have 220 units left to bill for this period of time. That's what that means. Okay, so that's the plan of care. Again, it's an authorization for you to be paid within MMIS. All right, so let's talk a little bit about billing. I still don't have any questions. Let me know if you have them. Go ahead and enter them, and we're glad to take them. Okay, billing. So your billing options, you'll bill on the provider web portal using one of these formats. So I know I mentioned this before. You have 2 different formats to choose from. The first one is professional claim. This is where you would submit a single claim for services, resulting in one claim number or internal control number, ICN. Same thing as a claim number. And then roster billing is where you have one form, and you fill in information, and it allows you to click submit or save. It might be save. And you would be submitting multiple claims for different clients. Okay, so on a professional claim, you're billing one claim for one client. On roster billing, you have multiple clients listed, and you could submit claims for more than one. And you get a unique ICN for each client for the roster billing. Okay, so we're back to that front page when you first log in. One of the important things that I did not mention before, but it really matters when you're looking at plan of care and billing, make sure that you're logged in under the correct provider ID. So make sure that you see the 9-digit MMIS provider ID that you should be logged in under right over here, under What's New. Okay, so there's our claims menu. I'll go ahead and move on to the professional claim. So this is what the professional claim form looks like. If you scroll all the way through it, this is the whole thing right here. Don't be overwhelmed, though. In-home care agencies only fill out sections 1 and 5. So it's not quite as scary as it looks. Okay, so here's section 1, and your required fields are the client ID and the from and to date. So these are the dates that you're billing for. Remember, you can only bill after services have been provided. So this one here, I have March 1st to March 31st of 2013. So obviously, I'm putting this claim in on April 1st or after of 2013. Now, just a note, this top section of the professional claim, a lot of the time, if you're talking to someone here or sometimes people in the provider community, they refer to this as the header of the claim. All right, so we'll go ahead and move on to section 5. Remember that you're skipping sections 2, 3, and 4 and going straight to the detail. And your required fields here are, again, the from and to date of service. So you do have to enter those on the top and on the detail line. The reason for that is we have a lot of providers that are coming in and maybe they're billing a date range for the entire claim, but they have more than one detail, and some of those details are only on one date of service within that range. So they have the option to detail it a little bit differently. So with your claims, you're going to probably have the same dates of service here as you do up top. Or you could break down the information per day. Let's say you're billing a whole month, and you provided 30 minutes on this day and 45 minutes on that day, and you would be able to break that down and put the individual dates here and put the units that you provided for each date. Okay, our second required field, units. Remember that the units are 15 minutes. So if you provided 45 minutes of service, you're going to have 3 units. You'll put your charges for this specific detail. So for however many units you entered here, you're going to put your total charges. And then if you go down to POS, that stands for place of service, yours is always going to be 12. 12 stands for home. And you're an in-home care agency, so that just makes sense. And then the 5th one is procedure. So make sure you enter the procedure off of the plan of care. And since that is the last section that you would fill out, you would scroll all the way to the bottom of the claim. Your claim status information would read not submitted yet. And you only have 2 options. You can either submit or you can cancel. Cancel just clears out anything that you've entered on the claim. Okay, once you do submit, within a few seconds, make sure you only click submit once. And then within a few seconds, you should get a claim status of paid, denied, or suspended. You'll get an ICN number. Again, that's the claim number. Each ICN is different. It's an internal control number for each claim, specific to this claim. And then you'll get a date here. The only reason you would not get a date is if your claim pays, then that date does not populate until after the payment is actually made. So payments happen over the weekend, so the date will populate over the weekend as well. And then you'll get your allowed amount. Now, I said that you would get some reasons as well. So these HIPAA adjustment reasons down at the bottom of the blue section here, those are reasons that the claim processed the way that it did. So you can take a look at those. If you get a denied claim, hopefully those will help you to figure out what's going on with the claim. Also, I'll just let you know that in those HIPAA adjustment reasons, if you look right here at the detail number, 0 means that it was affected because of the header. 1 would be line number 1, so detail, the first detail. If you had entered multiple detail numbers, then you would see the different numbers of the detail that this HIPAA adjustment reason code pertains to. So that's what that is. And then if you look right over here, once you submit the claim and you have a paid status, your buttons change right over here, and you have a few different options. The first option, again, is cancel. So you could actually be in this paid claim and make changes to it and adjust it if you needed to. You could void a paid claim. We don't recommend voiding. That just recoups any money that you have previously received. And then this is also where you would be able to copy a claim. So on a paid claim, cancel clears any changes. Adjust, if you made some changes to the claim, you could adjust. And basically what that does is it pulls the old claim and it puts a new claim in its place with new information. Keep in mind that anytime you adjust, you will get a new ICN number. So watch that number. And both of those numbers are now in the system. So you could actually search for this claim in this date of service, and you could see the original claim and the adjustment. Okay, we talked about void briefly. And copy claim, if you were to click this button, what would happen is the bottom of your claim would go right back to saying not submitted yet. But if you were to scroll up, you would see all the information that you had entered on the previous claim. So if you were billing something very similar, you would be able to copy the claim and make a couple of changes and then submit it as a new claim. Okay, question coming in. So if a client has 100 ADL hours authorized per month, the system will show 400 units? Yes, because an hour is 4 units because they're 15 minutes. Okay, and continuing the question, and since each home care client has ADL and IADL hours, the system will show 2 sets of units. Yes, so that would be 2 separate plans of care for the different procedure codes. And that's where you might get that list. Remember when we looked at the plan of care and there were search results and there was more than one line item that we could have looked at? And you would click on the one that you need to look at. So yes, 2 separate plans of care for 2 separate procedure codes. If it's 100 hours, let's say it's 50-50, then the one will show this 50 hours and the other one will show the other code with its 50 hours, which would be 200 units for each. Okay, another claim status is denied. So it looks similar, but it's denied, and the buttons are different. So on the bottom of a denied claim, you have a resubmit button. So hopefully what you would be able to do is look at these adjustment reason codes or scroll up and find your error and then be able to make a change and then click on resubmit. Keep in mind, again, anytime you're reprocessing something, whether it's a resubmit or an adjustment, you would get a new ICN number. If ever you click on submit or adjust or resubmit, and you either do not get the claim ICN or it does not change, what you need to do is scroll to the top of the screen and you'll see a black box with a message in it that will explain why the claim is not processing, because that just means it didn't process at all. If you have a brand new claim and you click submit and it just stays on not submitted yet, then it's not processing. A denied claim where you resubmit and the ICN doesn't change, a paid claim where you adjust and the ICN doesn't change, it's not processing. All right, and just a note at the bottom of this page, that claim status suspended. If ever you get a suspended status, that just means that the MMIS could not make the decision. So a person has to look at that claim. So it goes into a queue, and there are claims folks that go in and look at those claims and make the decision of whether to pay or deny them. So suspended claims are kind of like pending claims. You don't want to rebuild the service because it would be a duplicate. Suspended claims should be given a paid or denied status within, usually it's within a few days. So just keep an eye on it. All right, so let's talk about roster billing. That was the professional claim. So with roster billing, under your claims menu, you would click on roster billing instead of clicking on professional. So those are your two choices under the claims menu, professional or roster. So this is roster. And what you would do is you would enter your search criteria and you would click on search. What I did is I entered a date range. You could enter a client ID. It just depends on what you want to build. What this does is it gives you multiple items to build. So once you click on search, you'll get a list. So my list is 2 different claims for the same person here, but the different services. So we just talked about how there might be different services that are authorized. Now what I need to enter is, first of all, the from and to date of service. Secondly, the unit. I need to enter the billed amount and the place of service. I know the place of service is not marked with an asterisk. You'll notice the others are, and they tell you that they're required. You do also need the place of service, even though it's not marked. And then you would be able to fill out the same information on this line. And you may have 20 line items here with different clients. It just depends on what you searched for. And then once you fill out everything you want to submit, on the very last line item, you'll see a submit button. And that will process the claim. Now once you do that, you get this message here. It tells you how many claims processed successfully. It tells you if any of the claims could not be processed. And then it tells you to use the claim search to view the results. So it's a little bit different. You don't get the claim status right away. So what you would do to see the claim status is on your claims menu, you would select search. Now remember, when you use roster billing, everything that you fill out gets its very own ICN number. So you'll be able to find it in your claim search because the system keeps track of everything. Also, if you do have quite a list in your roster claims and you're going in to bill all these different things, keep in mind that the system times out after 20 minutes if it doesn't submit something or search for something within a 20-minute period. And sometimes it happens a little bit quicker than that. It just depends on security settings on your computer. You might want to start off with just billing 1 or 2 at a time until you get the hang of it. Because what might happen is if you're filling in 20 different line items, let's say you're filling them in, and it takes you more than 20 minutes, when you click on submit, you're going to be timed out, and all of that information is lost. So do keep that in mind. Okay, so claim search. Anytime you use claim search, you're looking for claims that have already been submitted. Whether they denied or paid or they were adjusted, any of them, they're all going to be in the system. Doesn't matter how you submitted them. So claims menu, click search. This is the claim search screen. And you can enter any criteria. It doesn't have to be the client ID. Could be the from date of service and to date of service. That's what this is here. Could be the specific ICN number. Could be a number of different things that you could enter here. So enter whatever you want to search by and click on search. If the system finds more than one claim matching your criteria, you'll get a list. So here's your search results down here. You would choose the one you want to look at and just click on it. Once you click on it, then your claim is going to appear. So it opens up that window with your claim in it. Now, if your search results are so specific, let's say you put in an ICN number here, and the system's only going to find one claim, what will happen is instead of getting this list here, the system will just open that claim rather than giving you a list. So here's what that claim looks like. It looks like the professional. Now, Keep in mind, you may have submitted these claims on the roster format, but the claim view is always going to be professional once that claim has been submitted. So remember when we got our little box that said use claim search to see the claims? Even though you submitted them roster billing, this is what they look like. Next question. Do you recommend home care agencies use the professional claim form when new to the system, then move to roster claims later? It kind of just depends on what you're most comfortable with. I like the professional claim. The roster claim seems like it would be really easy to use, but it's the same information. And I kind of tend to like that, okay, so I'm filling out this claim on the professional format, and I'm clicking on submit, and it's telling me right away. And I'm getting used to this claim form that I'm going to be looking at anyway, even if I submit on roster. So in my mind, that makes sense, but it would really be with what you're most comfortable with. And the only other warning would be that timeout thing. So if you have a whole bunch of clients that you're billing for a month, and you go in and you start to do that roster billing and you get timed out, that would be kind of frustrating. But since you're going to have to look at the professional claim anyway, that just makes sense to me. So we're on the same page there. All right, so here's our claim view, and you can see the claim outcome right down here. This looks very similar to the page that I previously showed you. It's a paid claim. And then you would get your allowed amount and everything here. This is where you would see if your roster claims had paid. All right, so that is Provider Web Portal function. And remember, I do want to go back for a moment, because when you're on this claim, remember that if your claim is paid, that you can make changes to it right here on this form and adjust it if you need to. Remember to always adjust the most recent claim. So if I submitted a claim and it paid, and I realize that I need to make a change to it, then I'm going to go in, search for that claim, pull it up, make my changes, and adjust. So my adjustment with its new ICN number is now my most recent claim. So if I needed to make another change, I would make sure that I'm working on that adjustment and not on that original. What will happen is if you pull up the original claim and you scroll to the bottom, you won't even have the option. It won't even give you the available button. What you will see, though, and I know this is hard to see on your screen, but right here there are a couple of added sections to the claim. These are not here when it's a brand new claim. One of them is an adjustment history. So you'll see the adjustments listed there, and you'll be able to click on them. So if this claim that I'm looking at right now had been adjusted, I would see my adjustment under the adjustment history and that new ICN number, and I would be able to click on it and get to that new ICN. And then, of course, the denied claims have the resubmit button and the cancel button. And you can make changes right on the form and resubmit. All right, let's go ahead and move on to resources. So if you need help, as promised, we have a DMAP Provider Services Unit. So the DMAP Provider Services Unit, they are familiar with the Provider Web Portal. They're familiar with MMIS. They can look up claims and help you with why they denied, if they denied, or why they paid at a different amount than what you expected. They have all that information. They can also help you with access issues with the Provider Web Portal. So if you, let's say you receive your 9-digit MMIS provider ID, and July 1st comes and you still haven't received your PIN, they can help you locate that PIN or reset it if it needs to be reset and get it out to you as soon as possible. So you can either email them or call them. And then DMAP Provider Training, that's my unit. So if you need to email us with any questions about training, if you need a slideshow or any kind of assistance at all, you would be able to reach DMAP provider training